Hello, everyone. Good afternoon, and welcome to the Health Economics uh, Unit and Division's noon seminar today. We have Federica Margini, who is a health economist working for UNICEF, and she has previously been based in a couple of African countries. Most recently, she was in Tanzania for several years, and she has moved back to Europe and is working in Brussels at UNICEF. Her research currently focuses a lot around nutrition, but her PhD focuses on postpartum hemorrhage and anemia and various other parts of maternal care, particularly around critical care. So, welcome, Federica, and thank you so much for presenting this very important topic to us. We're looking forward to hearing more about how the recent funding cuts have affected nutrition specifically.
Thank you very much, Lucy, and thank you everyone for your time for joining me today in this presentation. And I really hope that we will be able to have a very lively exchange, also building on your direct experience working in the past, but most recently over the past 6 months on health service and nutrition service delivery in Sub-Saharan Africa. I work with the Child Nutrition Fund, which is a UNICEF-led financing mechanism aimed at catalyzing domestic resources for nutrition. But today I won't be speaking specifically about that, but I will bring forward some reflection on what has been happening over the past few months around the nutrition landscape. I hope you're all able to see my presentation. I see heads nodding, so I will get started. So the reason why we are here today is because on the 24th of January 2025, the world went on shock. What happened? Some of you might not remember the exact day, but I'm sure that you're all familiar with the events that follow. So on the 24th of January, the President Trump issued the stop work order, and all the funding that was channeled for the delivery of essential health, nutrition, education, and broadly social services stopped. And soon after, the world went a little bit in despair, and nobody knew what was happening. And there was like a huge number of headlines, specifically around nutrition, that really tried to assess what the direct impact of this US stop work order was on the delivery of essential nutrition services, mentioning not only the health services, so the nutrition services delivered through the health system, but also all the food aid that for decades has been provided by the government, by the US government. What we've been seeing is like also over time, more and more estimates have been produced on the projected impact of the stop work order on the malnutrition burden in countries, in particular on the number of children affected by wasting that would not have been able to be treated anymore. But why are we speaking about this today? Is it something that started just 9 months ago, or is it something that had been going on for quite a while? And actually, the data tells us that in general, the patterns of development financing has been changing significantly since the beginning of actually the early 2000s. What we've been observing over the past 20 years, it's basically that international public resources for development have been stagnating. There's two different trends that have been increasing. On one side is the domestic public resources, and on the other is the domestic private resources. What we've been seeing also over and over again is a significant increase in the contributions from philanthropies. So when we put things into perspective and we focus on the health sector, which is often the point of reference to look at patterns of nutrition financing, because all nutrition-specific interventions are delivered through the health system, we actually see that since 2010, development assistance for health has only increased by 1.8% a year. And we're far off from what we would have been supposed to be had the trends of the early 2000s continued. When we look specifically at patterns for nutrition financing, we see that the same assumptions hold. Even when we extend our analysis around the past 10 years, we see that basically the only allocations that have increased are the allocations to the treatment of wasting, which is the most severe form of malnutrition, but actually all the other allocations to other core service areas like stunting, anemia, and breastfeeding have been at best stagnating. The other cost that we've seen increasing is this above service delivery, which also poses questions around the way we deliver nutrition services. When we look more broadly at the ODA flows towards nutrition, that include not only the flows towards the health sector for the delivery of nutrition-specific interventions, but also everything that is around food assistance, both in emergency and in development setting, we see that basically there was a bubble. The bubble that we can see is this upward trend registered in 2021. As a response to the COVID crisis, all major bilateral donors and multilateral donors have scaled up their investments towards nutrition. But as a matter of fact, this was just a bubble, because when we look at the data, we see that the increase is really time-bound. And this downward trend was happening, and it's not only led by the USA, but by all other, actually, donors, bilateral donors in the sector. In particular, when we take a close look at the various components of nutrition expenditure, according to the OECD's Creator Reporting System data, we see that there's one area that has been severely affected by the reduction in the allocations from the US government over the past few years after the COVID bubble, and this is food assistance. And so we foresee that many countries that are experiencing now the severe consequences of the US stop work order had actually started already seeing the signs. And in particular, some of the countries that are most affected are Ethiopia, Somalia, and Yemen, and Afghanistan as well. So what now? What is happening? Well, given the current situation, which has been exacerbated by the US stop work order, but did not start it then, what are our options? So in the context of the Nutrition for Growth Summit that was hosted in March 2025 in Paris, there was a commitment of over 27.5 billion. However, only out of these, only 13% were financing commitment, and the majority were instead political commitments. And when we take a look at the sources of this commitment, we see that roughly 50%, 44% to be precise, come from governments, and the second largest contribution comes from civil society organization. We see that the multilateral organizations, in particular the African Development Bank and the World Bank, have made commitments toward nutrition, but probably these commitments are still not sufficient. And overall, this commitment of $27.5 billion, which seems an enormous figure, is very far from what the World Bank tells us that is needed to deliver high-impact nutrition interventions. According to the World Bank Investment Framework for Nutrition, which was launched in November 2024, there is a need of an additional $13 billion every year in terms of additional investments to deliver a core set of high-impact nutrition interventions. And as you can see, this is just roughly half of the commitment that were made at N4G. So what is evident is that overseas development assistance is not going to be sufficient anymore to support the delivery of essential nutrition services. And this is something that we knew already, but now it's when it's actually time to act. And so there's a need of rethink about the way we make ODA allocations. And here there are some elements that, in my perspective, are important to direct the funding flow. The first of all is the burden of malnutrition. Right now, allocations are made predominantly thinking about what is the burden of stunting and wasting at country level. However, as some of you might have seen, yesterday, UNICEF published the 2025 Child Nutrition Report, where it was evidence that for the first time in history, we have a greater number of children who are overweight and obese than children that are wasted. This really defines a big turn in the epidemiological pattern of malnutrition. And therefore, whenever we think about making allocations based on the burden of malnutrition, it's really important that we take in consideration overweight and obesity as well. Then it's important that we look at the income level of the countries. Per capita income level, it's not an exact figure, but I think we can all say it's a good enough figure of the economic situation of the country. This alone, it's not a sufficient indicator. It's really important that we couple it with information regarding the debt distress level in the country. Why is it the case? Is because, first of all, we don't want the debt situation of a country to worsen, because the more the debt, the more the resources that the countries actually have to allocate to repay the interest on the debt, vis-a-vis actual investments in service delivery. And then the other reason why it's important is because when countries are in debt distress, really have challenges taking on additional loans from international financing institutions. And another element that, in my perspective, it's important to take in consideration is fragility. We cannot think of one size fits all, and it's really important that we take in consideration what is the political situation of the various countries. So in a way, we can also rethink about this refocusing this ODA around three pillars. One is what is the epidemiological profile of the country? The second one is what is the macrofiscal situation? And finally, what is the political context? So based on that, I think it's possible to categorize countries in three groups, and these are just indicative groups. And this is what I call domestic, blend, and humanitarian settings. And the various funding flow would take a different priority in this different context. In dark, we see the funding flow that should take priority. So for example, in countries where we have a moderate burden of malnutrition, we have a stable macro fiscal situation, which is a proxy for potential fiscal space for the countries to invest in nutrition. It's in a stable political situation. It's really important for us to work closely with the ministries of finance to make the case to invest in nutrition. Some of these countries are countries that can access resources from international financing institutions, and in particular, for example, thinking about the biggest international financing institution in the World Bank, these countries more likely will have access to IBRD funding rather than IDA funding. Therefore, the cost and debt is much higher, and this is why the first option should really be national resources, followed by international financing institutions funding. ODA will still be important, but it would be really important to think about how to phase out ODA so that, first of all, we increase the national ownership of the programs, but we also make sure that the very limited resources that we have can be allocated towards countries that need it the most. Then there's another set of countries, which is what we can define the blend countries. And in these countries, what we have, we can say it's the average lower to upper middle income country, where yes, we do have governments who are progressively increasing their revenue generation capacity, but they do not yet have a substantial amount of resources to invest in social service delivery. In these countries, it's really important to instead think about leveraging international financing institution, especially when we think about the World Bank. It would be in particular IDA credit that we know are very concessional loans. ODA would still be important, but we would need to think about ODA in a different way. So on one hand, we would need to think about this phasing out, which applies also to the previous category of countries, and instead it would also be important to think about how ODA can be allocated in an effective way. For example, are there some specific pockets of the country that have a very high burden of malnutrition, or are there specific parts of the country that have any that are fragile, or for example, are hosting refugee populations or are more prone to climate risk? In that case, it would be really important for us to think about how to make the most strategic use of ODA in the perspective of phasing out. There is a third group of countries, which is countries in humanitarian settings. And in these countries, we know that national governments do not have the capacity, and funding from international financing institutions can come only in the form of grants. This is where ODA is truly going to make a difference, and most of the resources should be channeled really as a way to ensure the continuity of care and making sure that the essential nutrition services are not disrupted. So what are our options to enhance domestic investments? As a matter of fact, we can think about it in three categories. The first one is thinking about resource mobilization. So whenever we talk about nutrition and health and resource mobilization, the first thing that always comes to anyone's mind is health taxes. While we know that health taxes are effective in reducing the consumption of products who are harmful to individuals' health, we also have to take in consideration that while in principle we would really like to have forms of earmarkings, soft earmarking at least, ministries of finance tend to be quite reluctant in putting this in place. So we need to think about other options that go together with health taxes and do not leave the pressure on health taxes alone. So one option is around salt and iodization levy model to enable the local production of these products that we know are extremely beneficial for individuals' health, but also to facilitate the import where at the subsidized price where production is not possible. Another way to make resources available towards nutrition is also through debt swaps. So this is an area which is, we can say, globally under exploration, but it's gaining more and more prominence. And the reason being is as most countries in low and middle income settings have huge amount of debts. And as I mentioned before, a lot of resources are channeled to the repayment of the bad debt interest rather on the on the payment of social services. So it's really important that we think about how can we put in place arrangement to enable debt swaps, while keeping in mind that while our focus is on nutrition, it's rather unlikely that the Ministry of Finance will approve a debt swap that is focused on nutrition only. Instead, it would be really important to think about how to embed nutrition into broader debt to health swap conversations. And this leads me to the second area where there are opportunities to enhance domestic investment, and this is around the budget process. So let me start from the last point, which is actually linked to what I just mentioned. And this is really about seeing nutrition not in isolation, but seeing it as a core component of the primary healthcare system. And this is why, as we develop budget guidelines and we develop budget programs, it's really important that we integrate nutrition within the broader PHC infrastructure while making sure that it still has sufficient visibility to make sure that resources are allocated against nutrition-specific interventions and expenditure are adequately tracked. And this is why it's really important to have systems in place from a public financial management point of view that enable adequate tagging of allocation and tracking of expenditure. Another two areas of work which are quite important is on efficiencies, and this holds for nutrition and for anything else, but in particular for nutrition, because we know that governments tend to invest significant amount of money both for the prevention and the treatment of malnutrition on commodities, it's important that we look at the efficiency with a specific focus on the procurement system. And we really ask ourselves, how can we make our procurement and supply chain system more effective? The final area of work, which sounds trivial, but it's not, because of the multi-sectoral nature of nutrition, is trying to align what are the policy level commitment made across the sector to actual budgetary allocations. What we see is that very often there's a misalignment between the commitments and responsibilities that fall under the various ministries who are responsible for the implementation of nutrition programs and policies are misaligned with the budget structures. And therefore, if they are mandated to invest in nutrition, they're actually not able to do it. Finally, there's a third area of work, which is purchasing. So strategic purchasing is very often very talked about when we talk about PHC services. But then the question, the challenge that remains out there for us is how can we actually make strategic purchasing more responsive to the needs of the nutrition subsector? And similar, this applies also to results-based financing. And therefore, how can we link results-based financing to nutrition without creating a parallel system? And finally, just some reflections for us to think about innovative financing, which I've put in brackets because I feel it's been many years that we talk about these innovations, but still I think where we're lacking behind is on the implementation, or if you want to be a little bit more optimistic, on the recording and evidence of generation around the implementation. So the first area of work is around outcome-based instruments, and this is really as a way to link investments to results, not only service delivery output. And these outcome-based instruments tend to be embedded in loans from international financing institutions. But it's the challenge that we have ahead is how can we actually introduce it on one hand on the way government makes plans and budgets, but also on how we allocate ODAs towards countries. Then the second area of work is actually bringing the private sector closer. We know that many countries, yes, they have a constrained fiscal space, but they have a very vibrant private sector. And so the real question here is how can we create instruments towards the enabling the attraction of working capital for local production to make sure that countries can rely as much as possible on products delivered in country rather than imported from abroad. And similarly, a very linked topic, it's the provision of guarantees for private investments, because we know that very often, even if there's a facility in country to produce specific products like RUTF, SQLNS, or MMS, as a matter of fact, the companies in country do not have the sufficient guarantees to put this in place. And then finally, one important point is to think about insurance and catastrophe buffers, for example, some disaster bonds. And this is also really opens a conversation on how can we draw a link between investments in nutrition and investments in climate, because we know very often when there's a climate shock, supply chains get disrupted. And then if there's also a disruption of the agricultural productivity, agricultural area of a specific countries, then it's more likely that the population will experience malnutrition challenges. And so if we are able to link the two by also making in a pragmatic way at the country level also some buffers of commodities linked for this, we could be in a position to prevent preventable wasting. As a matter of fact, none of these interventions are a solution on their own. It's actually important to think about how can we implement it in a holistic way, but also not having just, this is a set of opportunities that we have, but it's really important that we know how to contextualize them in a very relevant way for each specific country. And this is a challenge that we have ahead and that I hope will also be the start of our conversation together. Thank you for your time.
Thank you so much, Federica. A really lovely presentation. And the way that you put your slides together makes it feel like there are solutions and that actually things are quite neat, which I think we all know is not necessarily the space that we find ourselves in. So thank you very much for doing that for us. Just to kick us off, I wondered about what you thought about school programs and how we incorporate. So you mentioned having particular funding around, at a health facility, but what would you think about the school program models?
This is an excellent question, and it's something that I ask myself very often because we all know the importance of school feeding, but how does it actually work in practice? And I think one of the challenges that we see is that the cost of school feeding programs, and we have many economists I know here on the call, so many of you might have been involved in costing of school feeding programs, is really immense. And so for me, the solution would be how can we try to change the narrative about our school feeding program? And we change it away from this is a national government-led programs, and instead we try to bring it down to the lower level. On one hand, to provide to the local governments the ownership to do that and to provide the leadership based on the needs and the also practices from an like elementary point of view in feeding practices of the specific population of interest. But it's also because the solution to, I think, keep the cost down and spur economic growth, it's actually having school feeding programs that leverage local production capacity, products that are produced in the vicinity of the school and actually that can be run by members of the community. I think this is the only way to make not only the nutrition case for this, but also an economic case that would therefore incentivize more the ministries of finance or departments of budget at a subnational level to promote and sustain these programs. Over.
Yeah, really interesting. So I want to open the floor to those that are on the call. So if you are able to, please put your camera on. And if there are any questions, please go ahead and let's keep this conversation going a little bit more. So are there any questions? So another thing I was quite curious about, and you mentioned speaking to the private sector and bringing the private sector closer. I think this is really important because we've got this private sector, as you say, which is often quite vibrant in different countries. I know that in South Africa, we have so many different entrepreneurs and they are current in many different spaces. So I just wanted to know a little bit more about some of your experiences in different countries engaging with the private sector.
Thank you, Lucy. I have to say this is not my area of expertise, but it's definitely an area which is gaining always a lot of traction from all sides, from the private sector themselves, from civil society, but also from the governments. And I think the real question that we have is how can we engage the private sector and making sure that the products they produce, and I think this holds for nutrition products as much as it holds for health products, are of the highest possible standards so that the ministries of health and can actually purchase these products without needing to import them from abroad. So from my experience, it's quite limited. It's mostly interacting with some producers of RUTF, rapid to use therapeutic food, in Nigeria. And for example, one of the challenges that they faced is that they had to import peanuts from Argentina in order to be able to produce peanuts and to produce this ready-to-use therapeutic food. And which you think it's a little bit crazy, because any of us who spend some time in West Africa, you know that you see peanuts everywhere. The problem is, how can we produce the right peanuts of a high quality standard enough that enables the local production? And this was, in my experience, the interactions that we were trying to make. And I think this was quite interesting. Like, how can we actually invest in local production of inputs so that the ultimate product is more dependent? It's not, it like actually benefits the local economy. At the same time, I think one of the challenges that we have when interacting with government and with the private sector is to try to understand what is a reasonable market size for us to be able to, yes, have local production, but in an effective way. Because if every country starts, for example, production of MMS, it's going to be like it's just going to flood the market, and the companies are not going to be profitable. And so there's always say, like, look, if you want to invest in MMS production, it's important to think about what is whether you have at least 1 million pregnant women in the country. And this is the benchmark that we try to use. But this offers a lot of actually interesting conversation, I think, at the regional level, of sub-regional level, because then the challenge remains, how can we make sure that we don't only allocate resources for local production to the usual suspects, and we try to take a little bit of a more equitable approach and provide resources to the private sector across the region on one side, to be able to have like a fairer approach to stabilize the market, but on the others also, because if there were any market disruption or some political disruption in a specific crisis, we still have supplies available.
Yeah, I really like your response, because it actually it wasn't the thinking I was doing. I was thinking more about sort of corporate social investments and corporate social responsibility and philanthropy. So it's quite interesting, yes, to think about actually local production and how private companies can be supported, and you support the local economy. So I guess there's also the need to leverage on the sort of corporate social investments as well, because there's this huge kickback that private companies do get, and they need to be giving charitable donations and thinking about how they support local economies and local, yeah, not just charities, but local society level members. And so, yeah, I think that's a really important aspect that you bring up in terms of, yeah, these different ways of bringing in the private sector, and maybe something that we're not thinking about enough. Yeah.
But I think it's really important, actually, that you mentioned, Lucy, this point on philanthropies, because I think we see, like, all around the world, we see a growing interest from philanthropists to invest in health, I think, like, or like in social sector development. But I think this always comes a little bit with a challenge, because we've been used for many years to work with traditional institutional donors who are really interested in investing in systems. And what we're seeing from philanthropies is more this like project-based, product-based, intervention-based approach, which is what we had been trying to move away from, I think, for quite a long time. And so and I don't have an answer for this, but I do think it's something that I am seeing or observing a little bit. And so I think it's important that we are very cautious on how, yes, we leverage the philanthropies, but we are able to maintain this system-based approach.
Yeah, good point. Are there any other questions from the room? See, there's also a comment to say thank you very much for the presentation that you gave. And I agree, it's a very timely talk to have. So if there are no questions at this point, I think we'll wrap up. And thank you so much, Federica, for giving us this talk. It's given us a lot to think about and many different avenues to think about as well. Thinking about strategic purchasing in the area of nutrition is something I hadn't really considered before. So yeah, lots of food for thought. So thank you so much for sharing
Thank you, Lucy.
your insights.
And thanks, everyone. And yeah, feel free to reach out if you want to discuss more about this.
Thank you, Federica.
Have a nice day, everyone.
Yeah, you too. Bye.
Thank you. Bye.